All right. Good afternoon, everyone, and welcome. My name is Courtney Washington. I am the social media manager at Prisma Health. And on behalf of Prisma Health, we would like to thank you all for joining us for another Facebook Live town hall. So as South Carolina's largest healthcare system, we created these town halls to provide information on a number of different topics related to healthcare and then the well-being of the people in our communities. So the topic today is dentistry. So September is National Gum Care Month, and gum care is an important topic to discuss because our gum health is related to our actual overall health. So healthy gums can protect us against disease-causing bacteria and also other chronic illnesses. So today we have a great panel of experts to provide us with information related to dentistry and answer any questions that you may have about oral health or dental hygiene. So if you have any questions, please leave them in the comments and we'll make sure to answer them. So our panel today is Dr. Cindy Nichols, Dr. David Hicklin, Dr. James Curtis, and Dr. Scott Balzer. So thank you all for joining. All right, so let's get started with Dr. Nichols.
Courtney, we need to record.
Sure, I'll make sure to do that. There we are. All right, Dr. Nichols, first question goes to you. So it's very common for children and even some adults to be afraid to go to the dentist. So can you share some knowledge as to why people are afraid to go to the dentist and what can people do to reduce that fear?
Dental phobia is a real thing. We are very empathetic to people that are afraid to go to the dentist. And I think statistics say about 35% of all people have a dental phobia. We probably say it's more like 50 to 60%. We have most of the people that sit in our chair every day express some degree of dental anxiety. And it usually stems from a past experience, an unpleasant past experience, maybe a toothache that was uncontrollable as a child, or maybe they just have a family member that has had a questionable experience, and just through the rumor mill, that has built anxiety in patients throughout the years. Dentistry today there should be no fear associated with it. What we do on a routine basis to alleviate pain and discomfort with our dental anesthetics, with our nitrous oxide sedation, dental procedures are comfortable today, and pain should not be associated with dental anxiety. We can always try to alleviate fear by just starting with visits that aren't procedure-based. Just get used to the atmosphere, get used to us, build confidence within our patients. And if it comes to the last resort, we could call on our psychiatric colleagues to help walk through some treatment planning to prepare for dental appointments. We also offer moderate sedation to help control dental anxiety. And as an alternative and as a last resort, we would think about doing dental treatment under general anesthesia in the OR setting.
All right, thank you for that information.
Mm-hmm.
All right, so now let's hear from Dr. Hicklin. All right, Dr. Hicklin. So as we know, some people suffer from halitosis. So we would like to know what causes bad breath and how can people prevent it?
Thanks, Courtney, and thanks for letting us join you here today. I think immediately we start thinking about what are the immediate causes of bad breath, and then maybe what are the chronic or long-term issues with it. I think some of the immediate, more common things become smoking, coffee, garlic, maybe onions, and I think most of us deal with something like this on a day or maybe a weekly basis. And maybe the right answer is you just need to go brush your teeth, and I think that's okay to say. Many of the other issues become really chronic things. And so we start dealing with gum disease and tooth decay, maybe sinus infections or other head and neck infections going on. And The simple answer is it's a bacterial phenomenon. We need to look at the bacteria, what's causing it, and what can we do to sort of help slow, halt, or prevent the process. And many times that's going to be coming to visit us. Come see the dentist. Let us help get your mouth in good shape to help stop that process. You know, if I sort of take a moment and use a patient story, I had a patient a couple of weeks ago, and he comes and sees me, and sits down in my chair, and he says, you know, doc, I hadn't been to see the dentist in probably 5 or 6 years. I was like, wow, okay, well, why are you here today? He goes, because I hadn't seen the dentist in 5 or 6 years. I said, okay, I got that, but like literally, why are you here today? And he looks at me in all seriousness. He says, well, my wife says she won't kiss me anymore unless I make an appointment. I got to get this bad breath taken care of. And flat out, there's something to it. You know, we got bacteria that have accumulated over time. We got gum disease, and the relationship between all this, it created an environment that, you know, the girl just couldn't put up with. And so I think we're here to help.
Thank you. Thank you for that. And thank you for that patient story. All right, so we're going to move on to Dr. Curtis. All right, Dr. Curtis, can you share with us what causes jaw pain in both children and adults?
Sure. The two biggest causes of jaw pain would be an injury to the jaw or an infection in the jaw. And so those are obviously very different scenarios in which you're working. But if someone is involved in some kind of accident, whether it's playing sports or just taking a fall at home or involved in a motor vehicle crash, they may sustain a blow to the jaw that causes jaw pain. But I think what we see much more commonly is pain in the jaws that are arising from teeth that have advanced dental decay or actually may have progressed on to the point where the teeth are abscessed and the pain is as described by our patients, is down in the jaw is what we see. And so you have to address the cause of the pain in order to alleviate the pain.
Thank you. That makes perfect sense. All right, Dr. Nichols, let's go back to you. So going back to dental visits, so how can someone help a loved one or a child who doesn't receive oral care simply because they just have that fear of going to the dentist?
Well, Courtney, we usually start off with children with a happy visit, and they just come in and get used to the smell of the dental office and the sounds of the dental office and the people in the dental office. And I think most children find out real quickly that the dentists are their friends, and we're just here to help, to take care of, and comfort it however we need to make it a pleasant experience. And once you build that confidence, we're very confident in the work that we can do and how we can treat it and the methods that we have available to us to make it the most pleasant experience possible.
Thank you. Thank you for that. All right, so going back to you, Dr. Hicklin, let me pop you up here. So when should someone see a dentist? Is there a recommended number of times throughout the year to make these visits?
Thanks, Courtney. You know, I think the simple answer is today. You know, if you haven't seen the dentist recently or have an appointment on the books, it's time to call. You know, having your mouth looked at, having an oral cancer screening, having your teeth and gums looked at, it's part of the process and just needs to be part of the regular routine maintenance of our overall bodies. The same way we rotate our tires every now and then or get an oil change, let's make sure our bodies are in good shape as well.
Right, so we have a question that came in. So how early do you recommend a child should go see a dentist?
You know, at least by the time the first teeth are coming through. And so let's say by age 1, let's get started on that process. We're going to start early fluoride treatments. We're going to start really educating parents, making sure we're reducing sugary drinks and doing what we can to really help prevent tooth decay. A whole lot easier to start from a preventative perspective.
Absolutely, absolutely. All right, Dr. Curtis, I'm going to pop you up here. I have a question for you. So when it comes to our gum health, what are some tips to keep our gums healthy?
Oh, well, if you got a toothbrush, use it and use the end of the toothbrush that has the bristles on it for the most part. And I say that in a joking manner, but it is the mouth doesn't lie. When someone comes in to see me or one of my colleagues and they sit there and tell us that they brush their teeth 12 times a day and floss 5 or 6 times a day, and we examine their mouth and find out that there's all sort of buildup on there and food debris and everything else in there, you just know that the effort that they're expending is inadequate, or either they're just trying to pull the wool over your eyes so that you won't judge them. But again, the things that we have are tried and true and time tested, and that is a toothbrush and dental floss, or something that will help you remove the dental plaque from in between the teeth, whether it's floss or an interdental pick or stimulator. There are a lot of brand name things that are on the market, but it's a matter of working with your dentist, your dental hygienist, and determining what really works best for you, and getting the feedback from your dental team as to whether you're doing well with it.
Gotcha. So we have a very popular question about our teeth. So what are your thoughts on teeth whitening? Is it safe for people to do that?
You want me to answer that? It is safe. There are people that overdo tooth whitening. You know, if we look at the teeth that God gives each one of us, none of our teeth are as white as Dr. Nichols' white coat. They have some degree of color in them and everything. And when the whitening products were brought onto the market back in the early 1990s, they were thoroughly researched. And if you follow manufacturer's instructions, if you have whitening services provided in or through a dental office, those products are extremely safe to use. But if you are someone who abuses those, who decides that you want to whiten your teeth 365 days a year, then yes, there is some evidence that some damage can be done to the outer surface of the teeth.
Right. So Dr. Nichols, I want to pop you up here. I have a question for you.
Okay.
So can you explain how our oral health is, linked to our overall health?
Well, if you think about it, all the bacteria that sits in your mouth is what's feeding your entire system. So you want to keep the bacteria count as low as possible in your oral cavity. The studies show that periodontal health is linked to cardiovascular disease. We know that in turn leads to stroke problems. And so that's total body health. And if you have a chronic infection, oral infection, it's feeding into our body, and we extract teeth on a daily basis, and people will come back and say, I feel like a new person. And so infected teeth can cause a series of body problems that we probably don't even think about on a daily basis. So total body health starts with your mouth.
Thank you.
Courtney, can I jump in and add a little bit to that, please, ma'am?
Absolutely.
I just came back from a presentation to one of the upstate diabetes education groups this morning, and the link between chronic oral infections and inflammation and diabetes is exceptionally well known. And so that's another one. And we know that diabetes is rampant in this state. And so anyone with diabetes, in addition to having their eyes checked and their feet examined and things of that nature, they really need to be keying in to have a regular dental visits too. So thanks for letting me add that in there.
Thanks, Jim.
Absolutely. Does anybody have any additional comments for that question? Dr. Hicklin?
Thanks, Courtney. I think, highlighting the stroke thing a little bit, our department just finished a collaborative 6-year research study with also jointly sponsored by University of Chapel Hill, North Carolina. And we took, hundreds of patients who had literally just had strokes, and we provided dental care for them and fairly aggressive dental care, and sort of sat back and watched and saw what happened. And traditional medical literature is going to tell you, from the day one of a thromboembolic stroke, you're about a 24-25% chance likelihood of dying within 1 calendar year. And when these people got introduced into our study, we really reduced that number to almost 8%. Just by, cleaning their teeth, taking out the really bad teeth. And, use it as a specific example that, the reduction of bacteria that doesn't just stay in our mouths. It's really floating everywhere between our, scalp and toes. It's got long-term effects, and being able to work together, work with our medical colleagues to come up with ways to jointly treat these patients. Yes, it's complex, but yes, it really can have profound outcomes in people's lives. So,
Thank you. All right, do we have any additional comments or questions for our panel? All right. Do our panelists have any additional information they would like to share to our audience regarding oral health, dental hygiene? All right. Well, thank you all for the information that you have shared today and reminding us that our oral health is just as important as our overall health. I want to thank our panelists for being here today and providing the information. Thank you for everyone online for tuning in. If you would like to schedule an appointment or receive more information about dentistry, please make sure to visit our website because we have a lot of blogs online as well. All right. Well, we look forward to seeing you all for our next Facebook Live Town Hall. If you have any more questions, so please drop them in the comments and we'll make sure to answer those as soon as possible. Thank you and have a great day.
Thank you very much.
Thank you. Thank you.